Paralysis, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Paralysis, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of paralysis. Chapter 1. 1. What is paralysis? Paralysis happens when a person loses his or her ability to move voluntarily, a part or all parts of the body. 2. Can paralysis be temporary? Yes, paralysis can be temporary. 3. Can paralysis be permanent? Yes, paralysis can be permanent. 4. Can paralysis also happen slowly? Yes, paralysis can also happen slowly. 5. Can paralysis appear and disappear? Yes, paralysis can appear and disappear. 6. Can paralysis affect any part of the body? Yes, paralysis can affect any part of the body. 7. What is monoplegia? Monoplegia is paralysis of one arm or one leg. 8. What is paraplegia? Paraplegia is paralysis of both legs. 9. What is hemiplegia? Hemiplegia is paralysis on one side of the body. 10. What is paresis? Paresis is partial paralysis. Chapter 2. 1. What is tetraplegia? Tetraplegia is paralysis of the arms and the legs. 2. Tetraplegia can also be called quadriplegia. 3. Can someone be born with paralysis? Yes, someone can be born with paralysis. 4. What is diplegia? Diplegia is when paralysis affects the same region on both sides of the body. 5. What is localized paralysis? Localized paralysis is paralysis that affects a specific area of the body. 6. What is locked-in syndrome? Locked-in syndrome is a complete paralysis of the whole body, except for the muscles of the eyes. 7. What is the rarest type of paralysis? The rarest type of paralysis is the locked-in syndrome. 8. What is the most severe type of paralysis? The most severe type of paralysis is the locked-in syndrome. 9. What is periodic paralysis? Periodic paralysis is paralysis caused by abnormalities in electrolytes. 10. What are electrolytes? Electrolytes are minerals that carry electrical charge. Chapter 3. 1. What is Todd's paralysis? Todd's paralysis is paralysis during a short period after a seizure. 2. What is hyperkalemic periodic paralysis? Hyperkalemic periodic paralysis is a condition that causes muscle weakness and hyperkalemia. 3. What is hyperkalemia? Hyperkalemia is high potassium levels in the blood. 4. What is hypokalemic periodic paralysis? Hypokalemic periodic paralysis is a condition that causes severe muscle weakness and hypokalemia. 5. What is hypokalemia? Hypokalemia is low potassium levels in the blood. 6. What is thyrotoxic periodic paralysis? Thyrotoxic periodic paralysis is several episodes of severe weakness of the muscles. 7. What is Anderson-Tawil syndrome? Anderson-Tawil syndrome is a rare disorder of muscle weakness, abnormalities in development in the body, and arrhythmia. 8. What is arrhythmia? Arrhythmia is an irregular heart rhythm. 9. What are the signs and symptoms of paralysis? The signs and symptoms of paralysis are pain, stiffness, muscle spasms, numbness, flabby muscle, tingling, loss of sensation, etc. 10. What is the main function of the nervous system? The main function of the nervous system is the transfer of information between the brain and the body. Chapter 4. 1. How many parts of the nervous system is there? The nervous system consists of 2 parts. 2. What are the parts of the nervous system? The nervous system consists of the central nervous system and the peripheral nervous system. 3. What are the causes of paralysis? The causes of paralysis include trauma to the head, trauma to the spinal cord, a stroke, multiple sclerosis, brain tumor, cerebral palsy, myasthenia gravis, Guillain-Barré syndrome, spina bifida, Lyme disease, hereditary spastic paraplegia, post-polio syndrome, muscular dystrophy, etc. 4. What is multiple sclerosis? Multiple sclerosis is an autoimmune disease of the central nervous system. 5. What is cerebral palsy? Cerebral palsy is a movement disorder. 6. What is myasthenia gravis? Myasthenia gravis is a chronic autoimmune disease characterized by weakness of the muscle. 7. What is Guillain-Barré syndrome? Guillain-Barré syndrome is a rare neurological autoimmune disease where the immune system attacks the nerves. 8. What is spina bifida? Spina bifida is a birth defect of the development of the spinal cord of a baby. 9. What is Lyme disease? Lyme disease is a bacterial infection spread through infected ticks. 10. Lyme disease is also called borreliosis. Chapter 5. 1. What is hereditary spastic paraplegia? Hereditary spastic paraplegia is a group of inherited gait disorders. 2. How is paralysis diagnosed? Paralysis can be diagnosed by X-rays, MRI, CT scan, spinal tap, myelogram, electrocardiogram, etc. 3. What is a spinal tap? A spinal tap is a medical test of the spinal fluid. 4. What is a myelogram? A myelogram is medical imaging of the spinal cord. 5. What is an electromyogram? An electromyogram is a medical test that tests the electrical activities of the nerves and the muscles. 6. Are there complications of paralysis? Yes, there are complications of paralysis. 7. What are the complications of paralysis? The complications of paralysis include breathing problems, anxiety, depression, dysphagia, blood clots, deep vein thrombosis, speech difficulty, erectile dysfunction, heart problems, sepsis, urinary incontinence, etc. 8. What is dysphagia? Dysphagia is difficulty swallowing. 9. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in a deep vein. 10. What is sepsis? Sepsis is a life-threatening response to an infection. Chapter 6. 1. What is incontinence? Incontinence is the loss of the ability to control the bladder. 2. How is paralysis treated? Paralysis can be treated by physiotherapy, occupational therapy, speech therapy, equipment that helps mobility, pain medications, muscle relaxers, surgery, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding paralysis.